All right, we told you about that open letter that some British medical experts wrote asking UK leaders to make sure the country is prepared if there's a second wave. My next guest is among those who signed that letter. Martin Marshall is the chair of the Royal College of General Practitioners, and he joins me now live from London. We're not really even out of the first wave, but you're already worried about the second wave?
Yeah, that's absolutely right. I mean, I think people are starting to celebrate the release of lockdown, but we have to remember that this isn't a virus that's gone away, as our chief medical officer reminded us of a couple of days ago. We are all expecting there to be spikes, local spikes, and I think most people are expecting there to be a second wave and maybe even a third wave later in the year over the winter. So what we're asking for with this letter to the political leaders is to take a little time out, to reflect, to look at how we've done, to learn, and to do things better when the next wave comes along.
Yeah, and the UK, the deaths per 100,000, those numbers are really, really bad for the UK. I mean, apart from Belgium, the UK is at 64 deaths per 100,000, Spain at 60 deaths per 100,000, and Italy, which was sort of devastated by the virus in the earlier days of the pandemic, at 57. Why did it go so wrong in the UK when they had so much warning that the virus was coming their way?
I don't think we know the answer to that. I agree with you that the UK has not fared well, and I disagree, I have to say, with your previous speaker. But we don't know exactly why. We know that some countries seem to have done very well. The UK has not done well. Belgium has not done well. Italy, Spain has not done well. But at the moment, I think it's too early to be absolutely sure what the reason is.
Yeah. Yeah, the previous speaker was the father of the prime minister, so I guess it's not shocking that he would think his son did a good job. But so what needs to be done to fix the problems that we faced so far for a potential second wave? What do officials need to be doing, but also what do we need to be doing, just individuals, participating in the greater effort to try to mitigate some of the effects of a second wave?
Well, let me start with officials first, because that's the focus of the letter that we wrote to the political leaders. And we say there's a number of areas that we think we can learn from in the UK where things haven't gone as well as they might have done. One of those is around better integration between hospitals and general practice and community services and social services. One of them is about better procurement, particularly of things like personal protective equipment and testing. One of them is about getting the right balance between what happens centrally within government and what happens at a local level. One of them is about making sure that we protect the most vulnerable people in society, and particularly the Black, Asian and minority ethnic populations. And then the final one is about what we can learn from other countries, as we were just discussing. If some countries have done well, some countries less well, what can we learn from those that have done well? So that's what we're asking from policy. Right. From individuals, a lot of it actually is really quite basic and will be very familiar with people. So the virus is less prevalent in the community, maybe 1 in 2,000 people. What we need to do, though, is remember that it's still infectious, remember about good hygiene, remember about social distancing, remember basically to look after yourself, particularly if you're vulnerable. And those are the kind of things that we really want the public to continue doing, and not pretend as if the virus has gone away completely.
Yeah, and as we keep saying, we're sick of the virus. The virus is not sick of us yet. Martin Marshall, the chair of the Royal College of General Practitioners, thank you so much for joining us. Hope to speak again very soon.